All right, guys. So in this video, what I want to do is I want to use Chat GPT. I want to try to train Chat GPT 4 to be my personal physical therapist. So let's take a look at this. Let's talk about a person who maybe lives somewhere in the world where they don't have access to physical therapy, but they do have high-speed internet. So where are the best resources? We've got a couple to choose from, and I'm thinking about what is something that I can process through Chat GPT 4 and what is something, that might be too large or inaccessible. So I want to say Brigham and Women's Hospital, they have physical therapy protocols that are published. I'm going to say we've got a person who had a rotator cuff repair. So we've got rotator cuff repair, large, massive tear. Let's go with that. It gives me this PDF file. I'm going to copy the URL from the PDF file. It's still loading. And then what we're going to do, we're going to go to chat. We're going to come down here. We're going to say, can you please read and process the information and I'll just drop in the URL. Now, sometimes it works, sometimes it doesn't. I have a workaround in case it can't read and process the PDF, but let's see what happens. You guys are watching this in real time. So I'm using Web Pilot as the plugin for Chat GPT 4. This is the premium version of Chat GPT. So I'm paying $20 a month, I think. Okay, so it says documenting provided detail rehab protocol for arthroscopic rotator cuff surgery. Goes through information. We have these various phases. We have that. Awesome. What I'm going to do now, I can go out and I can find other protocols, but let's just start with this. Let's come in here and say, I would like you to make recommendations I can follow. I just had rotator cuff repair surgery 2 days ago. And I don't have access to a licensed physical therapist. What should I be doing for my rehabilitation at this time? Now I'm trying to think in my head, like, what should I be asking? What are the right questions? Let's see what it gives me. Sorry to hear about your surgery. Hope you're on the mend. Based on the rehab protocol, currently in phase 1, which lasts the first week to 6 weeks. Goals: protect the tendon repair and promote tendon to bone healing, reduce inflammation and pain. Precautions: do not actively move your surgical arm, no weight bearing, no passive or active range of motion. That's interesting because passive range of motion is a huge element in early rehab. So let me see, I'm going to come back in here, see what this says. Yeah, clearly it misinterpreted. Technically, this doesn't actually say anything. No ER past 0. Here, special consideration of external rotation abduction, taken in case of subscap repair if passive needs to be initiated during phase 1. Okay, let's jump back here. Interventions: hand, wrist, elbow, range of motion, sling, criteria. Can you provide detailed descriptions of each exercise, intervention I should be doing? Also, are there any video or photo references I can see? And see what it does. Hand, wrist, elbow, active range of motion. Exercise involving scapular mobility exercises. Unfortunately, as an AI, I can't provide video or photo references. pretty straightforward. Remember to avoid any movements that cause pain or discomfort. Let's see what else it has. Can you explain what no weight bearing through the surgical arm means? Pushing up from a chair using, see, so like these are some interesting elements. I don't know that the layperson really understands what no weight bearing through the surgical arm means. So this gives me some information to better educate an individual. No passive or active range of motion. When you describe what passive range of motion is compared to active range of motion. Active refers to the movement of the joint that's performed by the individual themselves. For example, lifting your arm. Passive range, where performed by someone else, or a mechanical device, which I far prefer, and the individual does not use their own muscle power. Why would someone want to perform passive range of motion? Passive range of motion exercise, maintain joint mobility, promote circulation, prevent contractures, pain relief, assess joint health. I am experiencing excessive swelling into my hand and fingers. Is there anything I can do for this? Elevation. Keep your hand elevated a level of your heart as much as possible. Gentle movement, compression, cold therapy. Okay, so we get a lot of generalized information. We really don't get any specifics, but it's okay. I mean, it will get there. Something else we can do, let's take a look at this, and let's say therapeutic exercise. Is there a PDF? See if this gives us, okay, so this is the PDF of the full Kisner and Colby therapeutic exercise foundations and techniques. I am really curious. I'm going to copy the URL. I'm going to come back to the same chat that we've been working with. Now, can you read and process the information at the following link? Can you tell me what this resource specifically recommends I do during the first week following a rotator repair? Let's see what happens now. It's a 1,000-page PDF, 1,000+ pages. I have no idea how long it's going to take something like that to process. I don't know if it even can process it. Probably too many tokens, or there's got to be some sort of threshold or throttle on this. While that's processing, what I'm going to do is I'm going to come in here, Control F, rotator repair. Let's see what happens. So right here, page 550. I'm sorry, 570. Let me jump to 570. Looks like it might still be downloading. Let's scroll. 546. $551. And down here, 565. All right. Right here, rotator cuff repair and post-operative management. So it starts on book page 570. We can see indications for surgery, procedure, post-operative management. We can see here onset of injury, chronic impingement, atraumatic cuff deficiency, slower progression after acute traumatic injury. I wonder if I could tell it to read these specific pages. Clinical tips. Let's see. Scroll down. Shoulder instabilities. Okay, I'm going to say 570 to 575. Let's try this differently. You process the information between pages 570, 575 on this web page. Link you provided is possible kind of not accessible to format. Let's see what it does with this. I'm giving it a limit. There are other options, so I'll show you another option. I can come in here. I can go to print. I'm going to print 610. I'm looking at the PDF pages. Yeah, my screen's frozen now. I'm totally dead. I don't know if you guys can still hear me. I'm going to have to give this a minute. This chat still won't process the request. Okay, so I'm going to save as a PDF. I'm going to go to custom pages. I'm going to go from 600, whoops, to 610. Let's see what this will do. Sometimes what I try is I can print those specific pages as a PDF. I can upload that PDF to my Google Drive. I can have Google Drive convert it to a Google Doc, and I can have Chat GPT read the information from the Google Doc, or I could publish the Google Doc and then have Chat GPT read the URL for the published Google Doc. So let's give this a try. So I'm going into my Google Drive. I'm going to click on New, Upload File. I'm going to go to my downloads. I'm going to grab the 10-page PDF that I just generated from the Kisner and Colby text. I'm going to open the PDF inside of Google Drive. I'm going to click Open with Google Docs. We're going to let this process that information. We're going to go File. As soon as it's ready, there we go, File. Waiting for it to render. So I'm going to go Share, Publish to Web. I'm going to publish and ask for a link. I'm going to copy that link. I'm going to go back to Chat GPT. I'm going to say, actually, I'm going to go up here. I'm going to edit this request. I'm going to put the Google Doc link in there. And I'm going to have it reprocess that query. So my query was, now can you read and process the information on the following link? The link is a Google Doc version of the 10 pages that came out of the PDF. And I say, can you tell me what this resource specifically recommends I do during the first week? So here, based on the information, document, control pain and inflammation, prevent loss of mobility, develop control and awareness, restore pain-free mobility, prevent reflex inhibition and atrophy. What 3 exercises should I do each day at this stage of recovery? Let's see what it tells me. Active range of motion for adjacent regions, scapular retraction, assisted range of motion. This exercise is designed to maintain mobility without in the shoulder without straining the healing rotator cuff. Remember, these exercises should not cause pain. How often should I do these exercises? How many repetitions? See reps and sets to understand. Document provided doesn't specify the exact frequency, reps, sets. However, based on general physical therapy guidelines, you might consider the following. Interesting. And you create a 5-day exercise program. Include the recommended reps and sets along with specific exercises, and you put this all into an easy to follow table. Let's see what that does. Cool. Let's see what's going on. Day 1, day 2, day 3. And you now make a table of 5 achievable, I don't know how to spell it, goals that are function specific. For example, by day 5, I will be able to independently shower while maintaining proper safety precautions for my rotator cuff repair. Let's see. Day 1, goal 1, day 2, day 3, day 4, day 5. So day 1, I'll be able to perform an active range of motion exercise for my neck, elbow, wrist, hand without experiencing pain. I'll be able to perform scapular retraction exercises, improve my postural awareness and control. I'll perform assisted shoulder range of motion exercise, gradually increasing my shoulder mobility. I will be able to perform all prescribed exercise with proper form and without assistance while maintaining safety precautions. I will be able to independently perform daily activities such as eating and dressing and take a shower while maintaining proper safety and precautions. Okay, so I'm going to teach this a couple of things. So first thing I'm going to say is I'm going to take this. Please take your example from day 5. Do not include multiple tasks within a goal. This goal should be separated into separate tasks and activities. Goals, tasks, for example, eating should be one goal. Dressing should be a different goal. Maintaining proper safety precautions, a third and separate goal. I never spell separate correctly. Let's see what it does. I'm not telling it to rewrite it, but I figured it would rewrite it. So it's keeping the same 1 through 4. Now it's giving me additional goals. Independently take a shower, using a shower chair if necessary, while maintaining proper safety precautions. Consistently maintaining proper safety precautions throughout the day. Okay. So this is where I think we start to get into some interesting things. So let me take goal number 1. If you are acting as my physical therapist, can you create a 1-day treatment plan to achieve goal day 1 above? In detail, please explain what I should do to achieve this goal. Continue using a table to break each element of a 60-minute treatment session down by topic. Let's see what that does. I don't know if you guys realize, I know you're not a physical therapist. I don't know if you guys realize where I'm going with this. Basically, what I'm doing is I'm saying, hey, can we use a tool like Chat GPT to create a treatment plan for an acute treatment visit focused on achieving a single specific goal? Now, can you recreate that treatment plan? Can you include CPT code descriptions for each of those elements? Limit the CPT code utilization to CPT code 97110, 97530, 97535, 97112. Let's see what it gives us. And just to look at this, 0 to 5 minutes, 5 to 15 minutes. So like warm up, start with gentle warm up, prepare your body. This can include like movement of your non-surgical arm, lower body, or even walking. Neck, active range of motion, gentle movements of your neck, elbow range, active range of motion, wrist active, hand active, review, cool down. Now, this is totally a reasonable option for something that we could use to generate this based on published guidelines. So we have the professional documentation from Kisner and Colby and from Brigham and Women's Health. We have a written daily treatment. So this is interesting. It's categorizing review as CPT code 530. Dynamic activities to improve functional performance, review each exercise to ensure that you're doing them correctly, make sure necessary adjustments, technique. I'd probably tweak some of that. I don't think that really aligns with the definition. Cool down, self-care. Yeah, we couldn't really use those either. So it's not a perfect system, but imagine I take something like this, and this potentially is treatment session number 1. And treatment session number 2, number 3, number 4, and I go through a full, 24 treatment session plan of care with the documentation auto-generated. And then what I am left to do as the treating therapist is to assess the patient's response to this intervention, make recommendations for the follow-up session, and so on. I think there are some real potential use cases here. We just need to keep tweaking this and figure this out.